Welcome to Raising OKC Kids, Conversations with Metro Family in Oklahoma City. I'm Erin Page, and today I'm joined by Cara Gluck, local mom and public health professional, to talk about CMV, or Cytomegalovirus, which affects 1 in 200 babies born in the United States. Cara is here to mark June as CMV Awareness Month and help families understand this preventable virus. Thanks so much for joining me today, Cara.
Thank you so much for having me, and I am excited to talk to listeners about CMV and help anyone and everybody understand a little bit about CMV, what it is, how we prevent it, and ways that we can move forward in the most healthy way.
And we are looking forward to the opportunity to learn from you today. Before we jump in, I want to tell our listeners a bit more about you. Cara has a master's degree in public health and has worked in public health for nearly 20 years. She is mom of Jordan, age 11, and Parker, age 9. Cara is involved with the Oklahoma Family Network and the National CMV Foundation, for which she is an alliance chair for the state of Oklahoma. So Cara, let's start by just learning more about CMV. What is cytomegalovirus?
So cytomegalovirus is a virus that is naturally occurring in the environment. It is a virus that has been around for hundreds of years. However, if a pregnant woman is exposed to the virus while she is pregnant, she has the risk of passing the virus to her unborn child. If she passes the virus to her unborn child, then there is a potential for the unborn child to be impacted by the virus. What the virus does is it affects organ development. So large organ like liver, spleen, brain, lungs, and the development of the organs. And so depending on when that woman contracts the virus and it is transmitted to her unborn child, really will have an impact on the amount of effect that the unborn child will experience after birth.
Thanks for giving us that foundation to start this conversation. Cara, this is personal for you. Tell us your story with CMV. How did your journey begin?
So honestly, my journey began after Parker was born. Actually, he was probably about 12 to 18 hours old. I had a natural labor. I went into labor actually at about 37 weeks. My water broke. Took Jordan to daycare, dropped her off, went to the hospital. And when I got to the hospital, they determined that I had lost a significant amount of amniotic fluid. And so at that point, I was put on Pitocin and just went through the delivery process. However, when Parker was born, the very first thing that I said to my OB when he handed him to me is, "What is wrong with him?" And the reason I said that is because Parker had severe bruising, as well as these little blood spots, really from the very top of his head to his very, very, very purple little feet. And so that was the first thing that I asked. And my OB said, "Oh, don't worry about it. It was a fast labor. This is just the effect of the labor." We were moved to the labor and delivery floor, just a regular floor room, and really, given that opportunity to bond as a family. However, Parker started having challenges with maintaining his body temperature. And so we started doing lots of skin to skin. However, he was nursing well. Everything was good with his breathing. And they just thought, okay, this is just the effect of maybe the medication, and really didn't think anything of it. However, when that challenge started and continued, then we had a very astute floor nurse that said, he looks really jaundiced. And so made the recommendation in the middle of the night to go ahead and do a bilirubin panel. And when they did the bilirubin panel, it was determined that his bilirubin was very, very high. And so for his, how old he was, they typically don't check bilirubins until 24 plus hours later. However, at about 18 hours old, his bilirubin was well above the normal limits, and outside of the range for normal. And so the pediatrician went ahead and ordered more comprehensive blood work to be done, and then placed him under the Billy lights. You know, the lights that a lot of kids, a lot of newborns actually experience having to go under, just to help them with processing bilirubin and all of that. However, when we got his blood work back, it was determined he had incredibly low platelets, almost a transfusion level, and his bilirubin was very, very high. And so there were several other things that were outside of normal range. And so at that point, the decision was made for him to be transferred to Integris Baptist, and for him to get a higher level of care. And so we were transferred. And really at the beginning, all they kept saying is, were you exposed to anybody who's sick? Were you around anybody who didn't feel well? Have you done gardening? Have you changed kitty litter? Have you done any of those things? And the answer was just continuously no. And so they went ahead, he was showing or displaying signs of a viral infection. And so they did a urine culture, and a couple days later, we learned that Parker had congenital CMV. And honestly, at that point, we had no idea what that meant. However, we did what all of us do today, is get our phone and start looking up congenital CMV. And I will tell you, it was incredibly scary. It was incredibly scary because the things that you find online are really the worst case scenarios, as well as the fact that congenital CMV can have an incredibly broad array of impact on babies and on and on children. And so we didn't know what to expect. We just know that we started really down this journey of he was moved from right next to the nurse's station to a room that was in isolation. We ended up having to gown and glove every single time we interacted with him. He was in the NICU, so we didn't have lots of family who was coming to visit, but all of that potential was completely shut off at that point. And so we spent the next 10 days in the NICU. Really, the biggest thing that Parker was experiencing when he was in the NICU was his bilirubin levels just continued to get higher and higher and higher. And so what we learned is that his spleen was enlarged and his liver was enlarged and inflamed. And that is what was causing the bilirubin to go up. And so we spent many days on phototherapy. So he was on a Billy blanket along with the Billy lights. And really our entire goal at that point was for him to eat, so that way he could flush his system. And so luckily we were able to kind of change the trend of his bilirubin increasing to starting to decrease. And we ended up spending just about 10 days in the NICU. However, when we were in the NICU, that's when we got linked with the Oklahoma Family Network. And we had a family representative come in and talk to us about her experience with CMV. We had social workers talk to us and get us linked with Sooner Start or early intervention, because in Oklahoma, congenital CMV is an automatic qualifier for services. And so what that means is that whether or not you're seeing any delays or deficits, that child who has been diagnosed with congenital CMV is immediately referred for services, for referral, for assessment, and then developing a treatment plan from there. And so Parker actually started his early intervention and started with a physical therapist when he was 6 weeks old. So that really is a very big picture overview of kind of how we were introduced into this world of CMV. And I will tell you, the journey is different for every single family. There can be a child who has really this very similar exposure pieces or exposure potential things that could have a very, very different outcome than Parker. And but there are some things that are very, very common with children who have been infected and who are affected with CMV. And the reason that I say infected and affected, just because a mother transmits the virus to her unborn child doesn't mean that that child will see any effect or that child could be severely affected. And so, as I mentioned earlier, CMV has like this huge spectrum of impact that it can have on a child. One of the very, very common things that we see with children with congenital CMV is they're born and they appear to be very healthy. However, they fail their newborn hearing screening. They don't have a family history of hearing loss. So they don't, there's not an automatic genetic identification in regards to that. And so they'll fail hearing screening at the hospital, maybe fail their second hearing screening at the hospital, maybe get referred to the health department for a third hearing screening and fail all of those. And then learn that newborn has sensorineural hearing loss. Actually, congenital CMV is the leading cause of sensorineural hearing loss in children. And so there are families who identify or learn about CMV through that avenue. Or there will be families like Parker and our family, but really those newborns who are sick per se or symptomatic at birth is 10% or less. And so there are a majority of the babies that are born infected with CMV, we don't even know because it is not something we routinely screen for during newborn screening. And so we were fortunate in the aspect of we did get a diagnosis early and we were able to get to interventions early. However, not every family has that opportunity and may not recognize or learn about a congenital CMV diagnosis or even anything hear about CMV until far later in that child's life. The effect, like I said, it can go from failing a hearing screening or being very, very sick like Parker, or unfortunately, it can be fatal just because of the impact on the development of the organs. And so Parker has a multitude of secondary diagnoses as a result of the congenital CMV. So where Parker was mostly affected is his brain development. And so Parker has cerebral palsy. He has epilepsy. He has polymicrogyria, which is a malformation of the brain where the brain doesn't form normally per se. And he has lots of small folds in his brain that shouldn't be there. And so they're not deep folds, but they're very small folds, but they're numerous. He also has the impact that we've learned is that malformation of the brain is in the frontal lobe. And so the frontal lobe of the brain affects executive functioning, emotional control, impulse control, and really all of those interpersonal things that people need to have to be successful in life. In addition to that, he has he's got delays in regards to his fine motor development as well as his gross motor development. Parker didn't have good head control until he may have been about 8 months old before he really had good head control. He had delayed milestones. He didn't roll over like Jordan did in the same time frame, or developmentally appropriate per se, or those things, those developmental milestones, even though he had already started in early intervention. He didn't sit up on his own until he was close to 18 months old. He started using a reverse walker at 18 months old, and didn't walk independently until he was almost 3. He had AFOs and SMOs, so orthotics for his feet, to help give him his feet and his joints the strength to be able to even be weight bearing. So, Parker has experienced a lot, but all of those things, and Parker is an amazing little boy who is incredibly loving, and we are so blessed to have him.
Cara, tell us more about who Parker is today and who he is beyond his diagnoses.
Oh, Parker is a 9-year-old little boy who loves video games and farts, just like all young boys at that age. He loves jumping on the trampoline. He loves his family, his puppies. He loves to entertain or be the center of attention. If he sees a microphone, you better watch out, because he wants the microphone. He wants to tell jokes. Everybody knows that that Parker is a comedian. He has performed in more than one talent show at school, telling jokes. He loves drums, and he loves the guitar, and he loves all types of music. He loves books. But I say above and beyond all of that, he loves his family. He loves big, and we're so fortunate.
I love that. Thank you for giving us a peek into your life with Parker. As we're talking about CMV, we talked at the beginning that it affects 1 in 200 pregnancies. 1 in 8 of those experience long-term developmental impacts from CMV, like you mentioned, and up to 80% of adults in the US have had a CMV infection by age 40. So this is a common viral infection. We're going to get to talking about prevention and screening, but I want to start with a larger question here, Cara, and you have been in public health, like we said, for almost 20 years. And this was not something that was extremely familiar to you before your own journey with it. So why are we not talking as a society more about CMV?
Unfortunately, I will tell you that is the question that all of us families that have been impacted by congenital CMV ask. Why were we not educated? Why didn't we know? And I will tell you, when I went back and talked to my OB, when I've talked to our neurologist, when I've talked to really all kinds of providers, the first thing that they say is, well, we don't want to create additional anxieties because there's nothing you can do. However, that's not incredibly true. Like I said, it is a virus, and we know that there are viruses all over the place, right? And we're exposed to viruses every single day. We know that. However, if a woman who is pregnant makes some basic behavioral modifications and takes some basic safeguards, she can reduce her risk. And so when we ask providers, that is the foundational question that we hear, or the foundational answer we hear over and over and over. Well, there's nothing you can do, and there's so many things that a pregnant woman has to worry about. We don't want to scare her. And in my opinion, if a pregnant woman knows that there is a risk, or that she has some risk factors, then she can make behavioral changes. She should be afforded the opportunity to make the changes that she sees fit for herself, for her unborn child, and for her family. And so when I talk about some behavior modifications or some things that can be done, really, truly, very, very, very simple things. Making sure that we're effectively washing our hands with hot water for 20 seconds after we come in contact with bodily fluids. So if we have been around a young child and we have changed a diaper, or we are working in a daycare center and a child slobbers on a toy and we pick that toy up, any bodily fluid, we want to make sure that we're washing our hands with hot soapy water. We want to make sure that we're minimizing our exposure to bodily fluids. And when I'm talking bodily fluids, I'm talking about saliva, I'm talking about urine from young children. And then obviously blood is a bodily fluid as well. But really the two that we see with high transmission rates is saliva and urine. And so if you are a mom of a young child, ages 1 to 3 or 4, about 70% of those children have come in contact with and are carrying the virus at any given time. However, if a healthy individual is exposed to the virus, like you said, about 80% of people have been exposed by the time they're 40. If a healthy individual is exposed to the virus, they may have some basic viral symptoms, maybe a sore throat, maybe a runny nose, maybe a little bit of fatigue, or maybe nothing at all. But that virus, they're exposed, they're infected, their body is able to fight it off, and they go about their business, and then they just have antibodies. However, that pregnant woman that gets exposed, she then has the potential to pass the virus to her unborn developing child. And that's where that risk factor is propelled significantly. And that's the area that we really, really want to make sure that we are looking at in making those behavioral changes. So risk factors, being around young children, specifically young children who are in a daycare setting who are exposed to other young children. So if you are a mom to a young child and you are pregnant, making sure that you're being very, very careful with not sharing drinks, sharing utensils, putting the pacifier in your mouth to clean it off when it falls on the ground, sharing toothbrushes, any of those things. And I know that when having a young toddler, like I did when I was pregnant with Parker, your plate as mom is has like a big flashing neon sign. And for whatever reason, it is so much more tasty than whatever is on your child's plate, that toddler's plate, right? So just making sure that we're not sharing the utensils and we're not sharing the food. We're not allowing a young child to drink after us, or we drink after that young child. When we give kisses to our toddlers, that we give kisses on our cheek, forehead, or top of the head, just for that time that we are pregnant, not for that child's entire life, just for those 40 weeks. And those are just some very basic recommendations and behavior modifications that can reduce the risk for a woman to get exposed, as well as transmit the virus to her unborn child.
Definitely things that every mom or person who works in a childcare facility who is pregnant needs to know. And I know when we've talked previously, I have been pregnant 3 times. I knew nothing about CMV. I had not heard about it until I had the opportunity to talk with you. And like you said, had I had that opportunity to be educated, I certainly would have made some of these behavior modifications that you're talking about, just to know that I was keeping my unborn baby safe. So I like that you talked about if we just could give more pregnant women the chance to make that decision for themselves, we could really make a difference. One of the other.
Oh, I'm sorry.
You go.
When we know better, we do better, right? So it's just that basic thing of, let me know so that I can make a good decision and I can make an educated decision.
Absolutely. Another key factor here is that CMV is not included in Oklahoma newborn screenings, nor is it part currently of the CDC recommended universal newborn screening panel. And like you mentioned earlier, Parker was sick when he was born. So you knew enough to get those tests done, but that's not always the case. I think you said 10% are symptomatic and the other 90% are not. So some families don't see that impact until later. What do parents need to know about potential signs and symptoms, their right to request screening, and again, why that early detection of CMV is so important?
So first and foremost, making sure that we're aware of developmental milestones, and if a newborn is missing or not hitting that developmental milestone, going ahead and contacting the health department and early intervention, the Sooner Start program, so that they can get assessed. Because the earlier we're able to have interventions for a child, and that's not just with CMV, that's any baby who is not meeting developmental milestones. The earlier we get that intervention, the better outcomes they're going to have in life, because we're able to change those neural pathways. And the brain is such an amazing, amazing organ that we can do things early in life to help develop alternative pathways. So the first and foremost is if your baby is missing developmental milestones, if your baby has failed those newborn hearing screenings. In other states, there is legislation that has been passed that if a newborn fails 3 hearing screenings, that they're automatically screened for CMV. That's important because for a diagnosis of congenital CMV, that diagnosis has to be made before 21 days old. And so if we like kind of the pattern or the process is newborn screening happens at the hospital. If they fail, they do a repeat before discharge. If they still fail, they then get that referral to the health department or to an audiologist through their provider. If they fail that third time, automatically request a CMV screen, because that would at least tell us whether or not that baby has been infected with CMV. That would be the first and foremost thing. The second thing that I would say is anybody can request a CMV screening. You can request it when you're pregnant to determine whether or not you have antibodies and if you've ever been exposed to the virus before. However, that wouldn't mean, if you did have antibodies, that wouldn't mean necessarily that you couldn't get it a different strain and pass that to your unborn child. So that's really the reason that there's not universal prenatal screening. However, it's something that can be requested at that very first lab, that 12-week lab that they draw all kinds of blood anyway. Go ahead and have that screen done so that way you know where your risk factor stands. After the baby is born, when they're doing newborn screening, they can do a very easy saliva collection or a urine collection and do the test. And the test is like less than $50. And it is covered by most insurances as well as Medicaid. And so we're looking at a test that is very, very minute in the big scale of things when we're talking about cost, that could really help a family navigate their journey if they are told that their newborn is infected with CMV. Again, just because a baby is infected with CMV does not mean that they will necessarily have a long-term developmental effect, or it could mean that they will. And it could also mean that that developmental effect comes later in life because CMV is considered progressive. So, for example, with Parker, he didn't fail his newborn hearing screening. Even though he was very sick, he didn't fail his newborn hearing screening. However, Parker is screened every 3 months and he is seen routinely with Hearts for Hearing and an audiologist. He is screened every 3 months routinely. Well, we noticed right after a normal hearing screen in November, we noticed right after Christmas that he was turning up the television really loud. And so right before his 7th birthday, we got in and got screened again. And we learned that he had moderate to severe loss in his left ear, and profound loss in his right ear for certain decimals. So we continue our screening. Luckily, we had the opportunity to do a trial of an antiviral medication that he was able to take for 6 months, and we haven't seen any impact since right before he was 7 and he's 9. So it's been 2 years and he's been stable. When a baby is diagnosed as a newborn, the recommended treatment is antiviral medications for 6 to 12 months. And those antivirals, really what they are designed to do is to lessen the viral load so that the virus, we can stop the virus from impacting the brain development, the organs, and that type of thing. As well as if a woman is pregnant and she learns that she has been recently exposed to CMV, maybe she's not feeling well. I will tell you, thinking back to my pregnancy with Parker, we went to Florida to visit family for Christmas, and on the way back, all of us got sick. And we just thought it was a cold. You know, my daughter was sick, my husband was sick, I was sick. And then after that, in January, I remember going to the urgent care because my ears hurt. In February, I went back to the urgent care because my throat hurt. And really, what we have learned is that more than likely, I was exposed probably in that time frame, and that's when I got the CMV. And so, if a woman is not feeling well, talk to her OB and say, "Hey, can you just do blood work and determine my viral, to determine my titer levels?" And we want to look at the IgG and the IgM because that will tell us, one, whether or not she's been exposed in the past or she's had a recent infection. And so if she has had a recent infection, an infectious disease physician can work with her maternal, her OB or her maternal family medicine physician, and she can start antiviral medications while she's still pregnant, and then also lessen the impact of the virus on her unborn child. And we have families here within our network in Oklahoma who did antiviral treatments while mom was pregnant, and the impact on the kiddo is less severe. However, we also have families who have done antivirals and have had still the same impact. And so it's not a 100% treatment, but it's another option when we're looking at what the potential could be.
Such great information for parents to have. What are your hopes in terms of newborn screenings that CMV would become part of those either nationally or in Oklahoma? And how can local parents help advocate for that change?
Absolutely. So Minnesota, this past legislative session was the very first state in the nation to pass universal screening for all newborns as part of their newborn screening panel that they do for every single baby born in Minnesota. And truly, that's where I would love to see Oklahoma get. I would love to see every baby screened, because if every baby is screened, then we know. And if we know, we can put those measures in place to help with those outcomes. And early intervention works. Getting a therapist, whether it's an occupational therapist or a physical therapist or a speech therapist, to be able to work with that baby as soon and as early as possible, that's going to really have a significant difference in the trajectory of that child's life. And so that is what I want to see. I want to see universal newborn screening for every single baby born in Oklahoma. I mean, I want to see it for every baby born in the nation, but right now my focus is in Oklahoma because this is where we live and our children are important. My child is important. All of the other children that are born and all of the babies that are born in Oklahoma are important. They're our future. And so advocating for universal newborn screening, but until we get to that point of universal newborn screening, if you are pregnant, just ask for that test. Like I said, it's $50. And if I could have paid $50 for a test, it could have, it could have changed things. Parker was sick, and so we had, I guess you would say, the benefit of knowing early, but not every family knows that early, and not every child is going to be symptomatic or sick like Parker was. And so advocating for yourself as a pregnant woman, advocating for your unborn child, and advocating for your newborn once that baby is born, and asking for those screenings. It gives us at least a peace of mind to say, no, they're not infected, or yes, they are. And so I can start looking and being more aware. I can have a heightened sense of awareness of developmental milestones that are being missed, potentially hearing loss that may be expected or being experienced by that child. And so that is my biggest thing. I think every parent should have a choice as to how they move through their pregnancy journey. And I think having the ability to just be educated and to know what those risks are, so that way you can minimize your risk factors to have a healthy baby. I mean, that's what we all want, right? If every time somebody learns that you're pregnant, well, what do you want, a boy or a girl? You hear a lot of the time, I just want a healthy baby. We all want a healthy baby, but what if our baby is not healthy? What can we do to make sure that our baby has the greatest opportunity for success as they grow into adulthood?
Absolutely. And I would say we all have that shared responsibility to make sure that the families around us, even if our families aren't personally affected, to make sure that the kids around us have those great opportunities for success. As we wrap up today, Cara, whether it is in your advocacy work, out in the community, in your home, at work, where are you finding the greatest hope in your life right now?
Um, Honestly, I find hope in my children, in seeing, I mean, I've talked a lot about Parker, but Jordan, his big sister, there's a lot of hope with her too, because I will tell you, they may, they're siblings. And so they have their internal struggles and they fight amongst each other. But she is his biggest supporter. She is his fiercest protector. She is truly one of his biggest advocates. She has educated and advocated when she has had a child care provider who was pregnant, told them about CMV, wanted to share videos of Parker and wanted to share our journey with that pregnant caregiver, and so she is a force to be reckoned with. And I know that she would do anything and everything for Parker, and she has shown it time and time again, just whether it's being supportive on times that we are doing advocacy work. We've done a just an awareness run. We've For several years we did that. COVID ended up stopping that, and then we've moved to the Oklahoma City metro area, and so that is something that we're looking at. Hopefully, I don't know that I'm going to be able to get it done this year, but next year, an awareness run where we're just educating people and an opportunity to raise funds. Really, I would say. And then Parker, while yes, he has a lot of diagnosis, he's got a lot of things going on, but he really truly is a phenomenal little boy. And all people who come in contact with him, he makes a mark and he leaves an impression. And so that is where I really have incredible hope. I have incredible hope for him and his ability to live independently and be a successful adult, as well as advocate for himself when that time comes. And then his sister, who, like I said, she is just an absolutely amazing advocate and protector for her little brother.
You have two incredible kids, and they are blessed with a really incredible mom too. Thank you so much, Cara, for joining me. Thank you for sharing Parker and your family with us today, and for all the advocacy work that you are continuing to do on behalf of all of our families. Thank you.
Thank you so much for having me and allowing me to share our story today.
Thanks everyone for listening. Join us next time on Raising OKC Kids.